All right, ma'am, whenever you're ready.
Okay. All right. So I do want to talk about the Tinian cases. We do have one index case on Tinian with a second case in the same household. And then we do contact tracing found 2 other cases on 2 different households. And those individuals have been identified and have been isolated. There is discussion with the delegation of Tinian currently that we're trying to determine what is the next step in case cases increase, and that's the possibility of having a quarantine site specifically for Tinian, and also consideration to look into is also, a quarantine site for Rhoda. There's at this point right now, since our community case, we saw a surge of over 500 cases. We like to remind the community that no other medicine or intervention has been nearly as effective in preventing severe illness and death as the COVID-19 vaccines. In the NMI, we have about, more than 36,000 of our population are fully vaccinated, and about 8,000 have already received their booster doses. We're working with the federal government to expedite our supply of vaccines. If you have seen our notice that we are running short, and it's basically it's actually very encouraging to see that more people are getting vaccinated, but unfortunately, delivery is not as ideal as we wanted it to be, but we are expecting a supply sometime by the end of this week. So our current situation, it is disheartening and frustrating as we continue to see unvaccinated individuals admitted to our hospitals to our hospital with the serious complications and at the alternate care site due to serious complications of COVID-19 vaccination. We have 7 hospitalized at this time. 1 is vaccinated and 6 are unvaccinated. And again, we continue to emphasize that this is preventable. We are, of course, especially concerned about the health and safety of our vulnerable populations, including the elderly, those with coexisting medical conditions, and of course, our frontline healthcare workers and our frontline team. We are seeing our emergency rooms slammed with individuals, coming in with symptoms, and it is overwhelming for us. Again, with the surge of the COVID-19. Again, 7 individuals not hospitalized. That is as concerning for us as the health system. This hinders our ability to care for other patients experiencing severe illnesses such as diabetic complications. Again, this is regardless of their vaccination status. So, as I mentioned the other day, it's exhausting, disheartening to see more and more patients, especially if they're, having to be able to get severe illnesses because of their status of their vaccination. And so, we all have a responsibility. And again, it's a lot of this is really about behaviors. We want people to understand that first of all, the vaccine is safe and effective. And if you are eligible, please, try to get them, especially as soon as we get our more supplies to that. Please practice the 3 W's. I mean, especially right now at this point, I know that some individuals are having a hard time getting a slot in the testing. So if you feel like you are, or that you may be a contact of someone who is positive, the first thing you got to do is really stay home and, quarantine, self-quarantine, and wait for a call if you need to be transported. But if you are going to be, getting tested, and you're waiting for your testing, at this time, you should be really in quarantine and avoid contact with others if you can. And so while you wait for your testing, or while you wait for your results, we're still seeing a lot of households that are affected and not just individuals. So this is also disheartening to see. So anyway, that's all I wanted to update you. And of course, if there's anything else you want me to update with, just let me know. Thank you.